This meeting is being recorded.
Hello, my name is Amanda Clark, and our group did Telehealth, Technology, and ABA, the pros and cons. This was done by Amanda Clark, Marta Franco, Danielle Frisch, Sean Goody, and Latriva Ugu. So first, let me introduce the definition of telehealth. Telehealth is the use of telecommunications and informative technology to provide access to health or behavioral health, in this case, assessments, diagnosis, intervention, consultation, supervision, education, and information across distance. Tomlinson et al., 2018. It has been used to perform medical diagnosis criteria, assessments, maintenance of long-term health conditions, mental health services, and speech language therapy. We will be discussing the topic of telehealth as it relates to a recent global pandemic called COVID-19 and the necessity of alternative ways of accessing ABA services during this time. This has created a whole topic of discussion about the strengths, limitations, and effectiveness of telehealth services in the field of ABA. So each individual has assumed one pro and one con position in each topic of debate. I will announce the topic and the individuals participating at the beginning of each section. Now Danielle will address the background.
Previously, telehealth has been used in the field of ABA to conduct caregiver training and completing assessments regarding diagnostic criteria according to Nolte et al. 2020. This may have included collecting data while viewing pre-recorded videos or completing online coursework regarding caregiver training. Due to the COVID-19 pandemic, many schools, clinics, and businesses limited the availability of in-person services. This was problematic as practitioners had to navigate methods and platforms to provide direct ABA sessions for their clients. Also, prior to the COVID-19 pandemic, there was limited funding through insurance companies for ABA telehealth sessions. According to Nolte et al. 2020, they were primarily paid for by private insurance companies in extenuating circumstances. After a public health emergency was declared due to the pandemic, the U.S. Department of Health took extra measures to make telehealth services more accessible. As a result, ABA therapy via telehealth obtained a higher coverage by insurance companies. This was an important contribution as it was an effort to limit the spread of the COVID-19 virus. Additionally, this resource also promoted the health and safety of clients, families, and staff members.
All right, next we're going to address ability and limitations. Latriva will address the pros.
There are many benefits to providing ABA services via telehealth. One of the most important benefits is that it allowed those who would traditionally not be able to receive ABA services due to location to be able to access services. Those who live in rural areas can access the benefits of ABA services without having to drive hours or not even receive services at all. The recent pandemic made telehealth a more popular option as children were able to continue ABA services through telehealth. The use of telehealth can be conducted using a cell phone or a computer. There are government services available that allow for those who aren't able to access electronic devices like cell phones and computers to access them for free or at a reduced cost. If there is a caregiver who is not familiar with the use of a Chromebook, they can use their cell phone to access the same services as they would be with a computer because they're more familiar. Trained staff, such as the BCBA or the RPT, can also go to the home for the initial visit to help with training the caretaker on how to properly use the devices for future use.
Now Sean will address the cons.
Due to the caregiver ABA technology barrier, clinicians could run into a hiccup when trying to conduct ABA services via telehealth. Majority of caregivers will have little to no experience with ABA technology. This leaves a high probability that the caregivers of our clients require substantial training and coaching to implement ABA interventions. In some instances, multiple consultation sessions may be needed needed before it is even advisable to move forward with the direct telehealth services between the behavior therapist and the caregiver or client, according to Rodriguez, 2020. If the caregiver is relatively well trained, the caregiver could still require coaching to sharpen his or her skill set for foundational skills related to facilitating the treatment plan, such as redirection, prompting, and delivery of reinforcement. Also, according to Rodriguez, 2020. If the caregiver is not yet trained, they could require substantial training to implement this intervention. Lastly, there are also limitations with delivery and implementing intervention that focus on fine and gross motor skills because physical interaction is required when needing to prompt those skills, according to Tomlinson, 2018.
The next topic is prerequisite skills that are needed to participate in telehealth. Latriva will address the pros.
There are many different skills that can be taught during telehealth visits. The BCBA can see what skills the client has and what skills are able to be taught during a telehealth session. This can be done through initial assessments. Telehealth services require that the client be in the same room with the device that the services are being delivered on. Telehealth services require attention. The parent can be trained on how to provide the services and skills that are required for on-the-spot responses. For example, if you're trying to provide a reinforcement, the BCBA can teach the caregiver to identify the behavior and when to properly present the reinforcement. This allows for follow-up visits to be held in a full telehealth fashion. Table 3 shows the type of skills that can be taught during an ABA telehealth session. They include tacting, intraverbals, manding, listeners, reading, and math skills. As you can see, the BCBA can teach intraverbal skills like, what do you call a large body of water surrounded by land? The BCBA then can do a verbal prompt to teach the response, a lake.
Sean will now address the cons.
In order to conduct ABA via telehealth, we must examine various factors, such as the client's prerequisite skills, which affect how telehealth direct therapy is conducted with each client, according to Nahalti et al. 2021. Clients with limited skills may present with particularly challenging repertoires for the current telehealth model, such as extremely limited joint attention, the necessity of frequent redirection, a scarcity of potent reinforcers, and the presence of intense or dangerous problem behaviors. More substantial modifications are needed for skill acquisition programs when the client demonstrates a moderately low level of skill sets or has a heavy reliance on physical prompting and continuous schedules of reinforcement to respond correctly in trials. Lastly, according to Nahalti, a specialist in the area of telehealth effectiveness for individuals with autism and the clinical director of Center for Autism and Related Disorders in California, providing behavior analytics services in person allows the BCBA and behavior tech to benefit from strong stimulus control that may not be present in the home setting.
Next, we will address the effectiveness of interventions. The first topic will be minimal skill regression due to caregiver involvement. I will address the pros. Research has shown that whether an in-person setting, school setting, or a telehealth setting, the more knowledge and involvement caretakers have in their client's learning, the better the outcome for the client. Nullity et al. 2020 comments on the correlation of involvement to results, stating, furthermore, in a review of the literature, Freiling, Wallace, and Yassine 2012 identified a correlation between treatment integrity and the effectiveness of the intervention. Thus, the evaluation of intervention to support treatment integrity likely will impact the effectiveness of the intervention itself. Any support or education that can be given to a caregiver increases the potential integrity of the intervention. While it is an increase in time and training for the caregiver to ensure that the patient participates in telehealth therapy sessions appropriately, there is the added benefit that the greater level of interaction may increase parent confidence and thinking more clinically. Now Danielle will address the comments.
However, some challenges with telehealth include the degree of caregiver support, difficulty developing client rapport, de-escalating problem behaviors, and maintaining client engagement, according to Nolte et al. 2020. Whereas in-person sessions allow the RBT or BCBA to provide direct reinforcement to the client rather than relying on a caregiver to do so. It also may be challenging for a client to focus on a screen while listening and following instructions from an ABA provider for an extended period of time. Creating clear and concise expectations of the session, as well as a limited ability to perform prompting strategies, are additional barriers to telehealth sessions, as noted by Nolte. In-person sessions may possess more structure as the staff and clients are made aware of the format and overall expectations of the session.
The next topic is that the telehealth ABA is conducted in the least restrictive environments. I will address the pros. While it is true there is varied effect depending on the client in a telehealth session, this would be true in the case of in-person sessions as well. Some clients try in-home sessions and find that they actually learn better in a clinic or a group setting. Thankfully, even via telehealth, we can individualize to the needs of our clients and adjust the form and function of how we use technology to teach. Nolte et al. 2020 addresses the sliding scale of need by stating, thus, telehealth direct therapy varies on an additional dimension of the amount of support provided by the VT versus the caregiver. The roles vary on a continuum from the VT providing all skill acquisition and BIP interventions to the caregiver providing all skill acquisition and BIP interventions upon the direction from the VT. Some patients may be able to connect to the video conferencing software and gather any needed materials completely independently. Other patients will require a caregiver to complete these tasks. This means that similar to in-person sessions, the BT is still ethically responsible for the client and the person implementing the intervention. Whether this is the technician or the caregiver, the process is the same. Danielle will address the cons.
The effectiveness of telehealth will vary for each client, according to Nolte et al. 2020. Each client has different treatment goals, behavior repertoires. Behavior intervention procedures could also vary depending on the treatment goals and repertoires that may or may not be present. If there is a child addressing behavioral concerns rather than cognitive goals, then telehealth may not be as effective. In this situation, in-person sessions would be more beneficial when implementing behavior management procedures.
The next topic is caregivers that have an active role in treatment. I will be addressing the pros. Numerous studies have supported the utility of incorporating, accepting, and commitment training, ACT, and ABA services. Nolte et al. Comments on various researchers who investigate the effects of ACT on caregivers. Bethany et al. 2013 investigated the effect of ACT and instruction in ABA. Their results indicated that participants in the ACT group reported significantly less burnout when working with individuals with intellectual disabilities. It is true being an active participant in therapy sessions is time-consuming and honestly exhausting, but most likely caregivers will be caring for this client in some capacity for the rest of their life. Investing time now while they are young to increase the client and family's quality of life and independence is invaluable. While some families may not be able to provide significant portions of time, any time spent working on life skills, managing behavior, or functional communication is better than no intervention at all. Danielle will address the cons.
Telehealth requires an extensive time commitment for caregivers. They are expected to be present, attending, and or participating for the entire duration of the telehealth session. This may be challenging for some families and caregivers, as a caregiver may have other duties such as work or attending to other family members or other extracurricular activities outside of the home. Not only this, but according to Nolte et al., caregivers are also responsible for the client's safety and personal care, as the therapist is not physically present with them.
The next topic is Can the client effectively learn target skills via telehealth? I will be addressing the pros. A recent study by Pellegrino and Dengenario Reed 2020 addresses this gap in the literature. 2 adults with intellectual and developmental disabilities were taught independent living skills to the mastery criterion using total task chain presentation and least to most prompting over synchronous video conferencing telehealth sessions. Ferguson et al. Also taught skills through telehealth to direct therapy to 6 children with ASD in a small group format. All participants acquired their targeted lessons. Skill acquisition does take place within a telehealth setting. The mode in which it is taught should not be in question so much as the individuals that are implementing the intervention. In an in-person setting, you could also have minimal hours staffed or new technicians that cannot implement the intervention as effectively as others. The same applies to caregivers. They can continue to develop skills over time that makes the rate of acquisition increase based on their experience and coaching from a BT. Danielle will address the cons.
Some potential barriers of telehealth include maintaining treatment fidelity, client observation, and therapist supervision, as well as implementing role-play scenarios and collecting data, according to Tisami et al. 2019. Overall, there are limited resources available to implement interventions with high treatment fidelity via telehealth. This is crucial as every client deserves to receive effective quality treatment that is consistently provided across practitioners. Pollard et al. 2017 describes a few considerations that promote treatment fidelity during telehealth sessions. Their recommendations include providing adequate education and training for staff members, as well as proficient communication between staff, stakeholders, and clients.
Topic 5. The BCBA must consider potential modifications and appropriateness for each client. I will be addressing the pros. Rodriguez 2020 created a program modification assessment, PMA, to address how to appropriately program for a client and their designated caregivers. Designed to be conducted via telehealth consultation by the BCBA, the PMA entails 2 components. A, an assessment of the client's ability to attend and respond to skill acquisition programs, and B, an assessment of the caregiver's ability to facilitate skill acquisition programs and the behavior intervention plans. Right away, we are addressing the fact that in a telehealth model, the caregiver/technician's ability should be considered and programmed for, as well as the client's goals. It becomes clear the more research I read that caregivers/technician training is one of the highest priorities and indicators of success in a telehealth model. Telehealth can meet a family where they are, providing the most effective amount of hours, the simplest or most complex programming based on caregiver ability, and the best way to observe, take data, and supervise the family to optimize a program that fits the client and family's needs. Danielle will address the cons.
Some barriers of providing telehealth internationally include different primary languages spoken, as well as a lack of technology and cultural beliefs and values, which all influence the quality of services. It may be burdensome for some families to receive language assistance with an interpreter, according to Tisami et al. 2019. Overall, it may be difficult to relay information through an interpreter, as the interpreter might have limited or no knowledge or experience in ABA or its interventions. An additional factor is that some words may also become lost in the translation between English and other languages. This will therefore influence the treatment fidelity and consistency as the interventions are delivered by the parent or caregiver.
The next section is affordability and time. The first topic is time cost, adds additional commitment to parents. Marta will address the pro.
In terms of affordability and time, telehealth is more cost-effective than direct therapy. Telehealth allows more flexibility in scheduling meetings and sessions, and it is more accommodating to everyone's schedule. Travel time is also no longer a variable that affects a client's or caretaker's ability to attend sessions since they no longer will need to drive.
Sean will address the cons.
We all live a busy lifestyle in today's day and age. When considering receiving ABA via telehealth, caregivers must be aware of the additional time and costs, such as attending sessions, familiarizing themselves with terminology, and appropriately implementing reinforcement and providing prompts in a timely manner. According to Tomlinson et al. 2018, his data research shows the overall scores report indicated that for emitting different words, making utterances, and initiating conversations, online therapy was less effective in approach. Additionally, caregivers may be unavailable or unable to facilitate services or incompetent with intervention implementation. Tomlinson et al. 2018 stated that this is why the training and understanding of technology is crucial, and the reason I believe there's a need for physical presence of an experienced clinician to implement certain interventions. Another con would be that during session, the clinician would need to take time away from the session and client to step in anytime the caregiver needs assistance with implementation, which would interfere with providing effective treatment.
The next topic is access to internet / tools / finances. Marta will address the pro.
The majority of people nowadays have access to technology that allows them to access telehealth services. Smartphones are one of the many options that are readily available. According to the Federal Affordable Connectivity Program, low-income households are eligible for financial assistance in paying for internet services and internet-connected devices. It offers up to $30 per month off your internet service and $100 discount for a laptop, tablet, or desktop computer. There's also HIPAA compliance and free to download telehealth apps such as Telehealth, Amwell, and Teladoc for iOS, and Doctor on Demand, Dialogue, and Lemonade Primary Care for Androids.
Sean will address the cons.
When considering the cons of telehealth and ABA, the cost and the setup are certainly two categories to consider. The internet may be free, but in order to access internet, it costs money to attain the equipment. Getting a Wi-Fi connection can be another dilemma. Even if you manage to find free Wi-Fi in a public area, the clinician must then be aware of confidentiality breaches that could occur, which could violate BCBA Ethics Code 2.03, protecting confidential information, and 2.04, disclosing confidential information. The display chart breaks down some of the costs and additional equipment clients may need to consider when wanting to engage in ABA via telehealth. You can see that even with a computer, you may still need to purchase extra equipment such as a web camera or extra software, and this can become very expensive very quickly.
The next section is the ethics of telehealth. Topic number 1 is communication. Marta will address the pros.
One of the pros of telehealth is that it increases accessibility of an interpreter to help to facilitate effective communication regardless of language. This encompasses ethics codes 1.07, 2.08, and 2.09, where essentially it is an analyst's responsibility to address the needs of individuals with diverse needs, use understandable language, and ensure comprehension of all communications with clients, and make appropriate efforts to involve clients and relevant stakeholders throughout the service relationship. If there is a language barrier, telehealth facilitates the inclusion of an interpreter to help translate. There are several companies where you can find someone who is certified and HIPAA trained who can assist in translating while also maintaining HIPAA compliance. This not only ensures that we maintain their confidentiality, but it also helps the caregivers and the BCBA discuss concerns such as the risks and benefits of telehealth-based services, such as confidentiality, what the ABA services entail, including the billing process, and ultimately asking the caregiver for their consent to proceed with services. The availability of an interpreter makes this possible and would ensure the caregivers and BCBA are all on the same page and on board with the interventions.
Latriva will address the cons.
Some of the barriers that clients seem to face is a language barrier. Telehealth ABA services generally include the client, caregiver, and the BCBA or RBT. The BCBA or RBT may run into issues of not speaking the language of the caregiver. The caregiver may not be able to properly communicate their concerns or understand what is happening. This could pose a problem when it comes to informed consent. The caregiver must be able to understand what they're consenting to. The article Comparisons of Telehealth Related Ethics and Guidelines and a Checklist for Ethical Decision-Making in the Midst of the COVID-19 Pandemic mentions informed consent. Code 2.11 says that behavior analysts must obtain informed consent before initial implementation of interventions or even assessments. Informed consent must be given for telehealth services as well. Clients must be made aware of the pros and cons of telehealth services and consent to those services.
The next topic is competency and client acceptance. Marta will address the pros.
According to the Ethics Code 1.05, practicing within scope of competence, behavior analysts can practice only within their identified scope of competence. If additional training on their part isn't sufficient to gain competency in a new area, they can always refer the client to another analyst who would be a better fit for them, and location wouldn't be a barrier. For those living in rural areas or in areas with smaller population of BCBAs and RBTs, it is already difficult to find someone to provide services for their child, and telehealth makes it more accessible for them to gain access to these services without placing an additional financial strain on the family due to travel needs.
Latriva will address the cons.
Telehealth services are a great option for those who need access to services that may not be available. When a BCBA is making a decision on telehealth services is an option for a client or not, they must think of safety first. Clients with high-risk behavior should not be serviced through telehealth. Code 3.01 requires the behavior analysts have responsibility to the client. This means they act in the best interest of the client. If the client cannot engage in intervention during telehealth and be safe, then telehealth is not a good option. Some self-injurious behaviors will require the BCBA to be physically present to prevent harm to the client.
The next topic is stakeholder involvement. Marta will address the pros.
In the Ethics Code 3.02 titled Identifying Stakeholders, the BCBA must identify who they'll need to collaborate with to set their client up for success. Paired with the Code 3.06, Consulting with Other Providers, it is the BCBA's duty to arrange for appropriate consultation with and referrals to other providers in the best interest of their clients and with appropriate informed consent. Telehealth would make it possible to include the entire behavior team in meetings that would otherwise be hard to plan and attend if they were in person. This could include the pediatrician, neurologist, school teachers, parents, or other caregivers, the RBTs, and other BCBAs who may have worked with the client in the past. With informed consent, this would make it easier to transition services as well, because you could meet with the caregivers and their previous or future BCBA and simultaneously include everyone in the treatment plans and keep them on the same page.
Latriva will address the cons.
Confidentiality is important, whether it be in person, at the clinic, or in telehealth format. Some of the concerns that can arise during a telehealth service visit is that the client's information is remaining confidential. ABA services allows you to collaborate with others, such as occupational therapists, pediatricians, and teachers on interventions for the client. This also can give others access to the client's information unintentionally. When sharing screens for providers, the BCBA or RBT can accidentally show information about the client that is not authorized to be shared with others. BCBA Code 2.03 talks about protecting confidential information, and Code 2.04 mentions only sharing confidential information when it's authorized to do so, when attempting to protect them, when trying to resolve contractual issues, when attempting to prevent a crime, and when compelled to do so by law. The article Comparisons with Telehealth Related Ethics and Guidelines and a Checklist for Ethical Decision-Makings in the Midst of a COVID-19 Pandemic also lists other risks to confidentiality during telehealth services. The APA guidelines list a number of potential risks, such as the use of search engines, participation in social networking sites, inappropriate and or inadequate breaches to established security methods, others gaining access to electronic communications, and therapist-client boundary issues.
The next section is addressing research. Topic number 1 is emerging research shows that telehealth could be an effective method. I will address the pros. Emerging research suggests that with more replication and research, telehealth could be an effective option for clients who fit the prerequisite criteria. There has been attempts to standardize a method and model of assessing the needs of a learner in a telehealth setting, as discussed in the article written by Rodriguez. Rodriguez states, the BCBA uses the telehealth model selection matrix to help guide him or her in assessing the client and caregiver's readiness for telehealth services by considering the extent to which program modifications and caregiver coaching are needed to support client progress. Based on the results from the PMA, along with the information about the clients and caregivers' repertoires, the BCBA uses the matrix to assess what he or she predicts will be the most appropriate telehealth treatment model. In the next slide, you'll see a systematic matrix that breaks down the levels of assistance into 4 parts. It starts with least restrictive need, all the way up to the most advanced problem solving required, the most restrictive. It gives you the topography and the abilities of the parent or caregiver, as well as the client, and how much assistance or who should be providing that assistance as they go. Danielle will address the cons.
Overall, there is a lack of research regarding strategies to develop and maintain rapport between the client and therapist via telehealth, according to Nolte et al. In 2020. Additionally, there is a need for more research for the effectiveness of ABA telehealth when serving diverse clients, as well as reducing a variety of challenging behaviors, competence and confidence of behavior therapists while conducting the session, as well as the effectiveness when combining telehealth with other ABA interventions and strategies, according to Tomlinson et al. 2018. There are many studies regarding children with ASD and functional communication training currently, whereas there is a lack of research for the effectiveness of telehealth in other populations that are served by ABA therapists. Overall, there's a great need for more research on telehealth and ABA in these areas.
The next topic is increased accessibility to ABA services for clients and their families. I will address the pros. While the research is still building on the effectiveness of ABA via telehealth, it does not change the fact that access to ABA where there used to be none has value, even if it had diminished capacity. It cannot be denied that telehealth increases accessibility to those individuals who didn't have it before. Rodriguez addresses some of the issues that can be resolved with telehealth. A number of logistical challenges can be resolved by delivering telehealth services. If through this crisis, the field of ABA can uncover tools to responsibly transition to telehealth services in a way that maintains clinical integrity and desired client outcomes, there are a number of potential benefits. Immediately, clients will continue to access services and countless jobs will be saved. The question is really how to begin to build a consistent, replicable structure that will provide the scaffolding necessary for a BT who needs to use telehealth exclusively or in a hybrid manner. Danielle will address the cons.
In the United States, there has been a strong demand and influx of BCBAs. However, there is a lack of research on the effectiveness of telehealth and ABA on an international level, according to Tasami et al. 2019. For example, in Mexico, there is a population of 127 million people and only one certified BCBA. Therefore, finding an interpreter to participate in telehealth sessions could be challenging, as previously discussed regarding the effectiveness of telehealth.
The next topic is a direct correlation is demonstrated between client progress and caregiver involvement. I will address the pros. Research is showing that there is direct correlation with client progress and parental involvement, whether in person or via telehealth. Yee and Dixon 2020 comment on the physical and psychological relief that training and knowledge brings to parents. Haas, Dixon, and Paolunas 2019 examined the effect of ACT-based intervention on parents of children with autism using a randomized controlled trial design. Results indicated that the 2-hour ACT workshop produced significant clinical outcomes on various measures of psychological flexibility and parental stress. The finding of our current investigation adds to the growing body of research demonstrating the effectiveness of incorporating ACT into parent training. While the effectiveness of telehealth for clients does not have enough evidence to directly support this alternative method long-term, the use of caregivers and the role they assume during telehealth supports growth and learning even outside of the ABA setting. There is a clear indication that direct stakeholders' involvement does make a difference developmentally in a child's success over time. Danielle will address the cons.
Although there are many reports of telehealth being effective during parent training, there is minimal research regarding the effectiveness of telehealth during direct ABA therapy sessions with the client, according to Nolte et al. 2020. Additionally, there is limited research regarding treatment integrity while conducting direct ABA sessions via telehealth. Therefore, it is important to construct measures to ensure that these sessions have high treatment fidelity and integrity. Also, there is a lack of effectiveness for the use of telehealth and ABA overall as compared to other professions. According to Tomlinson et al. 2018, in the year 2000, it was estimated that 90% of psychologists had utilized some form of telehealth to complete therapy. The lack of research regarding ABA may be correlated to the increase of telehealth usage due to the COVID-19 pandemic. Another consideration could be a lack of research regarding the effectiveness of ABA telehealth sessions as well.
Marta will summarize.
In summary, we discussed different topics on how telehealth technology and ABA could be beneficial as well as detrimental to our field. We touched on its abilities and limitations, specifically on how accessible it can be for those who may not have providers in their area, and how there may be a technology barrier when using the technology. The clients and even the caregivers will need certain prerequisite skills to use the technology effectively. The effectiveness of interventions was also determined, and we discussed how there may be minimal skill regression due to the involvement of the caregivers in the sessions. On the flip side, however, there are limitations on prompting and de-escalation procedures. Under the same topic, the sessions can be conducted in the least restrictive environment, but this may only work for certain clients, while others may need a more hands-on approach and in-person services. Their caregivers also have an active role in treatment because they are involved in the sessions and implementing behavior plans, but this can also be an extensive time commitment and more program responsibilities fall on the caregivers. BCBAs must also consider potential modifications and appropriateness for each client, meaning that on one side, telehealth is very flexible in delivering services based on scheduling and treatment needs specific to the clients, but cultural accommodations must also be considered. In terms of affordability and time, telehealth can be more cost-effective than in-person therapy due to scheduling flexibility. However, since the treatment goal would most likely be implemented by the parents, it would require more training than if the BCBA were physically present in the sessions. Access to the internet, tools, and finances should also be considered since many people may not have these luxuries. It costs money to attain the technologies such as laptops, cameras, internet services, etc., to participate in telehealth sessions, but at the same time, there are programs such as the Federal Affordable Connectivity Program that assist in acquiring these tools.
The ethics of telehealth, specifically communication, can be an issue due to language barriers. However, this can be addressed with the widespread availability of online HIPAA-compliant interpreters. Finding providers who can work within the scope of their competence from anywhere in the world would be significantly easier to access since telehealth is not limited to location. Certain clients who engage in high-risk behaviors may still not be able to benefit from this, since communication alone is not sufficient in addressing dangerous behaviors. Involving and collaborating with stakeholders would be easier through telehealth, since online meetings are easier to schedule and require no travel time. But this may also pose a risk, since confidentiality can be more easily breached, even unintentionally, when you have people in more than one environment collaborating and you cannot control those environments. Under the topic of research, emerging research is showing that telehealth is an effective option for those who meet the prerequisite criteria. However, there is still need for more research to determine if telehealth will consistently prove to be effective as in-person services. Research on telehealth is also showing that a number of logistical challenges can be resolved by delivering telehealth services, but there is still a lack of research showing that using telehealth and ABA can be effective on an international level. There is also some research showing that there is a direct correlation demonstrated between client progress and caregiver involvement. However, more research and data needs to be gathered on this to determine its validity. Next, we will answer some questions. The first question is, what is a BCBA's ethical responsibility when considering client preference in regards to the use of tele-ABA?
So according to the Ethics Code 1.15, behavior analysts must make appropriate efforts to respond to requests from clients. However, the Code 2.01 also requires analysts to prioritize clients' rights and needs in service delivery. This means they would need to provide services that are designed to maximize desired outcomes for and protect all clients, stakeholders, supervisees, trainees, and research participants from harm. If telehealth is a viable option, then it should definitely be considered if a client specifically requests it.
And the second question is, what confidentiality issues might arise when providing either in-home or tele-ABA therapy, and how should this be addressed?
So confidentiality issues such as screen sharing, the use of search engines, participation in social networking sites, inappropriate and or inadvertent breaches to establish security methods, and other individuals gaining access to electronics need to be considered. And to address these issues, you can use a privacy screen shield on the computer or phone device to keep others from seeing the screen, and making sure to close out additional web pages that were previously open to avoid any accidental breaches. Also, to avoid others in the immediate area listening into the call, the use of headphones could help to prevent this.
Thank you, Marta. So here are our references in case anyone would like to look into this further. This is our first page. And then this is our reference page continued. If anyone has any questions, we're happy to look into it or respond. Thank you for taking time to listen to our presentation. And we hope that you got some valuable information from this.